Okay, so this is a different study. Do we need to do this study?
This is post-adjuvant, to be clear.
So this is an individual who's had adjuvant pembrolizumab, and the gap is more than 12 months. Coming back to what Tian said, there seems to be, we're going to talk about the gap in a minute. We're going to talk about that in detail. Does this study need to be done? Who wants to kick off? It's your slide, Brian.
Yeah. Oh. I mean, they're all my slides. But I think the answer is yes and no, right? I mean, this study will be negative, right? So we don't need to do it. It's a waste of time and resources. Let's do other things with our patients' lives and time and resources. And even if we do it and it's negative, people say, well, what if it's 18 months? I mean, you know, if we're going to continually ignore large randomized data, then let's just not do it.
Toni? Would you ask Mike?
I mean, I think, would I do it?
With the limited bandwidth we have.
If that's the only trial I have, just because, you know, what we did the past 50 years in oncology in general with platinum, not with PD-1, is that in ovarian in this, we just limited 6 or 12 months after to Rechallenge. So as oncologists, general oncologists, we are stuck into this in the adjuvant setting. Do I think the biology is different? No, I do not. But will I think if it's the only study I have that there is equipoise, there is TKI in both arms, and just to answer it, yes, I would do it. But if there's another sexier trial, more for patient, it will get ahead.
Tian, what's your take on it?
Well, in my mind, you know, if we're doing this kind of trial, why not also add the other, you know, Ipi-Nivo, for example, right, that we know has benefit in first-line metastatic space. So it's not a complete picture of anything that the patient might receive in the frontline setting. But if we want to be clear and careful about generating the prospective evidence, then I think it should be done. Will it be done? I don't think that it will be done.
Oh, you didn't get permission. This is a very highly scientific poll. I wanted to actually.
Brian
had a fight.
I have nothing to do with these slides.
Brian had a fight on stage with someone. I had to separate them. So I launched this poll.
Yes.
Very highly scientific. I said after T-Nivo 2 and Contact 3, would you do a third randomized study with Pembro? Because no one has done it with Pembro, and Pembro, you know. And then look what happened. It was like 150 people.
So this is I think this is obvious for me.
Level 1.
We really shouldn't do that study. We do have a question, though, for the audience.
There's actually a series of questions coming up.
Yeah, so we've got some questions. So let's kick off with this first question. Would you do a study of a PD-1 inhibitor in RCC after prior pembrolizumab?
It can be Ipi-Nivo if you want.
But this is single agent, like no CTLA-4.
No CTLA-4, no CTLA-4. It's got to be PD-1. It's got to be a PD-1 inhibitor.
That's my question.
I think actually I'm chairing it, Brian. I know that you made the slides. I understand that. I can't make my phone work.
You need a new phone.
I do need a new phone. Okay, we're done here.
It's very close.
Yeah, well.
So we want to go and do this all over again?
Well,
have we not got better questions in kidney cancer?
Actually, no.
It is very split. So for those people who are listening, it's so would you do a trial of a PD-1 based therapy in renal cancer after prior adjuvant pembrolizumab? And it's 56, more yeses than no. David, does that depress you?
Yeah, a little. It's not. I don't feel super strongly about it. I don't think a trial like this is going to get off the ground. So.
Tian, you're comfortable with this?
I think if you say after a year, right, off adjuvant Pembro,
yes,
I think it would generate prospective evidence, and that would help us.
Can we move to the next slide? Because I think we've got some questions there too. We can move forward, that'd be great. Okay, so I've moved forward quite a few slides. Here we go. So if we were to do this trial, when would we have that minimum period? So Tian's just said 12 months. Most of you think we should do it. I'd really prefer it if only the people who voted that we should do the trial vote. Because if you don't think you should do the study, then it kind of becomes
number
pointless.
5
Then
would
they
be.
vote infinity.
Okay, infinity. Fine. Okay, if you voted no, then go for infinity. Oh, I'm pleased you're here, Brian. Otherwise, it'd be a disaster.
It's true for a lot of things.
So we can't make our minds up here either, by the looks of things.
Well, wow.
So I think we all agree that there needs to be a gap, and I think most people feel 12 months or more. So more than half the audience, about 60% believe 12 months or more. So Tian, I think you've got that right, by
Thanks.
the looks of things, that it's that first year is not long enough. After 12 months, if we were to do the study, that would be the fair time to do it. We agreed with that. Great.